Hi, so how to check and correct for an anterior or posterior innominate for a pelvic obliquity. First we're going to have Tiffany bridge up and then go back down flat. And let me raise the table up a little bit. And let's go ahead and straighten one leg and then the other. So you do the bridge so that you reset the pelvis. And then grab at the ankles. And you can come over this way. Grab at the ankles and just tug a little bit. And the patient can slide a little, that's okay. And then what you're looking for is something like this. Let's get a view straight down. So you can see that left leg is a little bit shorter. And then what you do, so left leg's a little bit shorter in this supine position. Then what we're going to do is keep the legs straight, the knees straight. I'm going to help the patient sit straight up. They rest back on their hands. And if their back hurts them, you're going to have to really help them with this and make sure that they rest on their hands to get up to this position. They may not even be able to get all the way up, but get up as far as you can. Then you recheck. And if there is, now remember we had a short left leg. Now let your legs go loose all the way. Just let them go. Okay. And now, if there was an obliquity, what we would see is now you can see that left leg is longer now than it was before. Okay? So let's have the patient lie back flat again, and what you'll see is it'll change, just like that. So now you can see it's short again. So it goes from short to long. When that happens, let me show you this is what pelvis looks like, pubic bone in the front. Here's the sacrum. So on this patient's pelvis, this left innominate, or left half of the pelvis, is posteriorly rotated. That makes that hip joint further away from me, further away from her feet. So it appears that that leg is short. Then when she comes up to sitting, now that hip joint is closer to the feet and makes that leg appear longer. So it goes from short in supine to long in sitting. This is what we would call a posterior left innominate. It could also be called an anterior right innominate because it's all relative. And usually I'll name them for whichever side the patient has pain on. So if they have left-sided pain, I would call that the left PI, or left posterior innominate. So let's do the correction for a left posterior innominate. We start by having the patient just squeeze their knees together isometrically. Not super hard the first time, but at the second and the third time, do pretty hard. And hold it for 10 seconds, and then relax. And then let's do it again. And now what this does is it pulls the adductors on either side and helps to separate the pubic symphysis a little bit and loosen up that innominate somewhat, at least in the front. And relax. And then we'll do one more. And relax and rest. Okay, now remember we have a posterior left innominate. So what we're going to do is we're going to use rectus femoris on the left to help pull that innominate forward, and we're going to use glute on the right side to help pull that anterior innominate on the right into a more posterior direction. So I always start with the glute because it's the easier one to do. So we'll straighten out this left leg. So we're going to try and use this glute because the pelvis is like this. We're going to try and use this glute on the right to help pull this half of the innominate of the pelvis backwards. So what we do is rest the patient's foot, the ankle, right on your shoulder. Let this leg go loose. Good. Make sure their leg goes loose. We don't want them to pull their leg in either. Keep it right about here. They will lift their foot up slightly off your shoulder and just push against your hand. So they're trying to push this way. I'm pushing that way, concentrating on using mostly glute on this side, gluteus maximus. Hold for 10 seconds and then relax. Perfect. And then we'll lift the foot up again and push. 2, 3, 4, 5, 6, 7, 8, 9. relax. And one more. Push. 3, 4, 5, 6, 7, 8, 9. Relax. Okay. And then we'll bring this leg up. Put this leg straight. Now we're going to use rectus femoris on the left to try and pull this posterior nominate forward. So let your leg just relax here for a second. Let's bring it out here a little. Good. All right, now go ahead. Pick your foot up slightly and pull that way. You can feel the muscle in the front of your thigh working. This is a little bit harder to do for the patient usually. Try to do the best you can. Hold for 10 seconds and then relax. Good. And just let it go loose. Good. And then lift again and pull. And you want to make sure you keep that foot up off the shoulder so that they're not using hamstrings, and relax to help. And you don't want to go too far up because you want to make sure it's mostly rectus femoris, so it's not a super hard pull. Go again, lift up and pull. One more time. 3, 4, 5, 6, 7, 8, 9, and rest. Okay. And then you recheck. Let's have you bridge up and down. And what we should see is pretty much even in supine, and we'll lift you up and rest like that, and pretty much even in sitting. So that's the correction. Okay, thanks. Good luck with everything.